Hello, I'm Dr. Wickham Simons, and this is Obesity Medicine Perspective. I'm an obesity medicine specialist, and I practice in the Triangle area of North Carolina. On the last video, I finished talking about the prescription diet drug Belviq, and I'm going to continue on that in this video. I want to make perfectly clear, however, that most of my patients are not on Belviq. They're not on any kind of combination therapy. Most of my patients are just on a single drug, and phentermine is usually the one that they're on, and there is never a requirement. When I talk about these drug combinations, this is not something that is ever required of you, and in fact, it's not standard in most cases. So I do, however, want to make sure that you understand that there are multiple treatment options, particularly as cases become more difficult to treat, because I think it's really important that you bring this body fat under control. And if you don't get it under control, I can tell you right now, you're going to end up with disease. And I always say you're going to go to the grave early, and you're going to go with a lot of disease. So whatever risk you're contemplating when you're talking about taking diet medication or combinations of medications, you need to weigh that risk against the risk of you getting sick because you don't do something about your weight and your body fat. And so it's in that context that I'm talking about these things. So I mentioned the fact that I take a combination of a low dose of phentermine and Belviq. And so people ask me, well, do you carry Belviq in the office? And the answer is no. It is a prescription drug that is not available generically, so I write a prescription for it, and you can get it filled at any pharmacy. Now, the way the drug works is that you have to take it for about 6 weeks to begin to feel the effect of the drug. So the first month to 6 weeks, you won't even notice that it's working in most cases. And so you have to be prepared for that. The drug company that makes it does have a savings program. So the most you can end up paying for the drug is $75 a month. Now, the drug is, in theory, or correction, in truth, a lot more expensive than that. But the drug company realizes that many insurance companies are not going to cover this, and the cost would be prohibitively expensive to pay for it. And so they designed a savings program which brings the cost down to $75 per month. And kind of the way that works conceptually is that you go to their website, and when you're here in the office, we give you a little savings card. You go to the website, you register, and you get a special set of papers and a card that you use at the pharmacy, and that takes care of all the savings for you. They even have a live department of people on duty to help you with any sort of insurance matters that might come up. It's my recommendation that you not even try to file it on your insurance, because I've not had patients that have had a lot of success in getting their insurance companies to pay for it, and it's just easier to use the savings card and to pay the $75 a month. The amount of money that you save by using insurance is usually not very much, if any at all. So anyway, I think that the company makes it fairly easy if you decided you wanted to use a drug like this and we thought it was okay for you, then I think in that case it's a fairly easy process and a relatively inexpensive process. Now, what you can expect once you've been on the drug for about 6 weeks is that you will get fuller faster once you start eating. The sense of satiety is there with much smaller amounts of food. And that is a very, very good thing because it helps you restrict portion size. The only absolute contraindication to Belviq is pregnancy, and we don't treat pregnant patients here anyway, so that's not going to be an issue. There is some potential interaction with some types of antidepressants, so that would be something that here in the office we would want to discuss with you if you were pondering a medication like this. So I would encourage you, if you think this might be a drug that you think you would need, that you make an appointment, that you come see us. Let one of our providers talk with you about it, and we can guide you in that decision-making process. Now, I'll continue to stay on this theme in the next video that we do. Until then, I want you to follow us on our YouTube site, on our Facebook site, and our Twitter site. You can get a free InBody 770 body composition analysis by doing that. So, until next time, I'll give you the tools, you give me the effort, and together we can overcome obesity.